Hello, welcome to VMC. I'm Dr. M. Today we are going to dive into the breed of Dalmatians. It's absolutely fascinating to me that humans form uric acid and so do Dalmatians, but there's no other breed of dog that does. So interesting. Now let's learn why this is, how we found out that this occurs, and why it's a problem. Join me, you'll learn something today. So in the 70s, there were some geneticists that discovered that all Dalmatians end up having this gene that means they produce uric acid. So they have what we call hyperuricosuriasia. Try to say that 5 times fast. And what it means is that it predisposes them to forming urate stones. This is especially a problem in male Dalmatian dogs because they have an os penis, meaning these stones are unable to pass through the urethra as the urethra diameter is limited by the presence of that bone. Female dogs have shorter and wider urethras, so they are less likely to be completely blocked by a stone. However, it's still possible. Now, it took until 2008 for a research paper to be published that identified the specific genetic issue. It is a recessive gene, and there are mutations in the SLC2A9 gene, and that's what is responsible for Dalmatians producing elevated amounts of uric acid. What I find absolutely fascinating is that the dogs with this mutation are also more likely to have clearer spots that have less white hair inside of the spot. And so the theory from some geneticists is that this mutation was selected for because people were looking at the spotting pattern of the dogs and they were not aware of what they were doing to the dog's urinary health at the time. I'll link in the description a podcast that is titled the Dalmatian Outcross Project, as it covers more of this information in more detail, and it's an interesting listen. So what are urates and how are they formed? That is an excellent question. So when a dog ingests food, there are a number of different nutrients that they are breaking down to be used in their body, and the waste products are defecated and or urinated out. One of the things that's being broken down are purines. And in most dog breeds, there is a 4-step process that occurs in the liver to break the proteins down. They're broken down and eventually become a product called allantoin, which is delivered to the kidneys, goes through the urinary tract, and is urinated out. And all of this goes swimmingly because allantoin is water soluble. In the Dalmatian, we have an issue going from the 3rd step of this process to the 4th. And so instead of producing allantoin, Dalmatians produce uric acid. And this becomes a major problem and sometimes an emergency because uric acid is not water soluble. So it can form stones in any part of the urinary tract, which is a significant issue because essentially the urinary tract is a bunch of small tubes, and blocking any of those in the kidneys or the ureters or the urethra will cause a medical emergency. And stones forming within the bladder cause pain in the bladder, inflammation. They can also cause damage to the bladder wall, and then if they get big enough and are tried to be passed, they can also block the urethra, which is another emergency. There were some additional research studies done going and ultrasounding all of the Dalmatians that they could find, and what was shocking to people at the time was that there were urinary abnormalities found in every single Dalmatian that was ultrasounded, all of them. Even if they weren't obviously clinical for having problems, they all did have problems because of this mutation. This is when it was determined that we really need to do something about this so that all of these dogs don't continue to suffer. And actually back in the 70s, there was a geneticist who became a Dalmatian breeder because he wanted to get rid of this mutation. He ended up back breeding a Dalmatian to a pointer in order to get some puppies that would not have this mutation anymore. Then he bred those dogs who did not have the mutation to Dalmatians to produce the next generation that did not produce uric acid. Then there were other breeders who also decided to put the health and well-being of their dogs as the primary focus. And they also backbred 2 pointers and then started breeding Dalmatians that did not have this hyperuricosuriate problem any longer, which is amazing and incredible. Over time, we ended up with Dalmatians who were 14 generations down from that back crossing, and genetic testing showed that they were over 99% genetically Dalmatian. The key was that they no longer produced the uric acid, so they had healthy urinary tracts. So wonderful. Then these dogs ended up starting to be registered in Europe, and then finally in 2011 they were allowed to be registered through the AKC as well. Wonderful, finally. Let's cover a little bit more information about the symptoms for dogs that are having problems with their urinary tracts. So if you have a Dalmatian that is not a low uric acid Dalmatian, then you need to be diligently watching for all of these symptoms. There might be blood in the urine, and because there are stones rubbing the tissues of the bladder or the urethra causing bleeding. The dog might have changes in their urination habits or in their drinking habits. They might strain to urinate, or they might have pain when urinating. Sometimes larger stones might sit in the bladder and intermittently block the outflow to the urethra. If an obstruction occurs, this is a potentially life-threatening emergency that requires immediate veterinary care. Now, I would be doing a disservice if I did not put this note in here. There is actually one other way other than this genetic mutation that can cause urate stones to form, and that is in dogs who have liver shunts. So if a dog has a portosystemic shunt, they may show all of these urinary symptoms that we just covered, but they also will tend to have some other symptoms like seizures or head pressing, and so this will require a different medical workup compared to a Dalmatian that has this genetic mutation we've been talking about. So how do we diagnose if a dog has urate stones? Well, in a urine sample, we may end up seeing the urate crystals, which have a specific appearance to them. The urine will also tend to be too acidic in these animals. If the stones are large enough and in the urinary bladder, sometimes we can actually feel them if the dog is relaxed enough, but often they're so painful that we're unable to. Unfortunately, urate bladder stones do not reliably show up on bladder x-rays, so we end up needing to do contrast studies or ultrasonography in order to find them. And the only way to get a definitive diagnosis is to send the stones away to a lab for analysis. This is particularly important because often we will have stones that can be of mixed morphologies. They might not be pure urate stones, is my point. So when we have a dog that ends up having urate stones, how do we go about treating this? Well, we have a few different options. First, we have medical management. This involves using a prescription diet that will be lower in purines so that the dog produces less uric acid. It will also help encourage the dog to drink and urinate more frequently, which flushes the bladder more often and means there's less time for the stones to form inside of the bladder, hopefully. And they will also help to control the pH of the urine and keep it more appropriate instead of being so acidic. We may reach for canned prescription diets because those contain even more water and can be even more helpful in flushing the bladder. Sometimes that's not an option due to budget, but it's preferred where possible. This is because stones are less likely to form in dilute urine. Now, dissolution only works if the stones are purely urate. As we briefly mentioned earlier, this is not always the case. Sometimes we have mixed stones, and so this may or may not be successful. There are some medications that can sometimes be prescribed that can also help to reduce urate production and can also impact urine pH, but they may not be appropriate for all patients. Your veterinarian can discuss that with you. Then we also have a number of surgical options. We can remove small stones through urohydrolysis retropropulsion. This is where we actually flush the stones out of the bladder using a special urinary catheter technique. Sometimes we can use a cystoscope to go non-surgically into the bladder and remove smaller stones as well. We also have ultrasonic dissolution. This is where we use a high-frequency ultrasound in order to try to break apart the stones into smaller pieces that then can be flushed out of the bladder. This option isn't widely used because of a lack of availability of the high-frequency ultrasound to break down the stones. But if it's an option near where you are located, your veterinarian will tell you about it. And lastly, and most commonly, is actual surgical removal of the stones, where we go through the abdominal wall, cut into the bladder, and take the stones out of the bladder entirely. This is actually one of my favorite surgical procedures to do because it does give such rapid relief to these patients, and they tend to heal and do really well from this surgical procedure. Of course, if a non-invasive option is possible, we'll go for that first. For dogs that have this genetic mutation, we also really need to focus on prevention. What that means is using a diet specifically formulated for Dalmatians that's research-based, that is low in purines, and that helps to support their urinary health. Royal Canin has a formula that I would reach for if I ever had a Dalmatian with this problem. We also need to ensure that these dogs have 24/7 access to water and that we're very on top of all water husbandry in order to encourage drinking. We look for their urine concentration to be 1.020 or more dilute than that, as that will reduce the risk of them forming stones. Bladder x-rays and urinalysis will need to be performed 1 month after they've had treatment for urate stones, and depending on what that shows, we will then select a monitoring frequency from there on out. This generally means a urinalysis and an ultrasound of the urinary tract every 3 to 6 months for the rest of their lives. And of course, in between those rechecks, if your dog is displaying any of the symptoms we discussed earlier, then they will need to be rechecked immediately. Don't wait. Now, I'm going to be pretty blunt with you here. Frankly, it is my opinion and the opinion of many veterinarians that the only ethical option to consider if you want to add a Dalmatian to your family is to find one from a breeder that does not have this genetic mutation. For the dog's welfare over their entire lives, not producing high amounts of uric acid is better for the dog. Hands down, period. There is nothing else that should matter more than the welfare of the animal that you're bringing into your home. There is no reason to keep producing dogs that live their entire lives with some degree of bladder and urinary pain. I feel particularly strongly about this because I have come across people with Dalmatians, and the breeder of that Dalmatian is telling them, if only you had done these 500 things, X, Y, Z, etc., then your dog would not have this problem. And that is just a bald-faced lie. This is a genetic issue, and the only way to ethically be producing Dalmatians is to make sure that you are producing dogs who do not have this genetic mutation. It should not be blamed on the people who are caring for these dogs. This is a genetic problem. Thank you so very much for joining me in today's video and for taking your pet's health seriously. I put out a new video most Fridays, and I hope that you and your pets stay happy and healthy until I see you in the next one. All right, bye.